How many caesareans will be performed here on average? Is a lot. 24 is a lot. In a busy hospital where they're performing a lot of surgical cases every day, they need to have enough instruments that they can adequately sterilise and have another kit to use while the other kit is being processed.
There we found that the instruments that they've been using only for 6 months have actually already started to rust. And whether that's due to some problems with the autoclave process, the lack of distilled water use, or whether it's actually the poor quality of the instruments, and I have to say those instruments are not good quality. You can see that the steel that they've used is of lower grade and it's not properly coated.
We do one C-section, and during the second C-section we then sterilize the other equipment. But if anything goes wrong in that process, you can't do the third one.
We even heard this story of a woman who had a uterine rupture during labour, and obviously that needed to be dealt with urgently because it's a life-threatening disorder. But in that instance, they didn't have the instruments. They didn't have enough instruments to deal with this. So they had no option but to send this patient to Jimmer. But unfortunately, along the way, that patient died. So every 2 or 3 years, you have to get new ones?
Yes. The doctor complained me, this scissor cannot cut it. This cannot click.
So what stops you buying good quality? Is it just price?
Yes.
Oh, Jesus. No. It's horrendous. It's getting worse. Honestly, it's getting worse. I thought that was bad, now we're getting to another league. Actually, the serrations have corroded away, there is nothing left. You're placing the patient at a massive risk.
And there's this graveyard of broken instruments, of rusty instruments, of corroded instruments. So I think the people really do feel we want to do a good job here, but we're just not being given the tools to do that.
Who fixes them?
We fix sometimes.